हा, 11 वाजता. काय झाले? बरं ठीक आहे. 11 नंतर माझं लेक्चर आहे आता ऑनलाईन. हां. हो हो. मी करते फोन तुम्हाला. ठीक आहे. वेलकम. Good morning, student. Today we have studied about the diseases of lens. In yesterday's lecture, we was learn about the diseases of the sclera, that is episcleritis, scleritis, and staphyloma with its homeopathic therapeutics. And today's lecture we will started with the diseases of the lens. So, in the diseases of the lens, the main disease of the lens is the cataract. So, diseases of the lens shows the symptom that decrease of vision for far and near. It is in cortical cataract. Then diminish of vision for the distance with a good near vision without glasses. It is in nuclear sclerosis. Then mononuclear diplopia or polypia and colored halos. It is in early immature cortical cataract. Then acute pain, redness and watering in an eye with the cataract. It is in early immature cortical cataract. Then next is acute pain, redness and watering in an eye with the cataract. It is in lens induced secondary glaucoma or uveitis. Then last is a white pupillary reflex as noticed by the parents or relative. Then in the signs of diseases of lens, we can see in a patient that there is a color of a crystalline lens. Then next is the presence of iris shadow. It is indicate the immature cataract. Then presence of a Purkinje's third and fourth images that it is indicates the normal transparent lens as they are formed by an anterior convex and posterior concave surface on the lens respectively. Next is a fundal glow on distant direct ophthalmoscopic shows the cataract as a direct dark opacity against the red background. Next is a slit lamp examination for a precise location and details of the opacity. And last is the absence of the lens. It is indicated by the deep anterior chamber and tremulousness of the iris due to the loss of support of the iris and by the absence of third and fourth Purkinje images. So these are the signs and symptoms of the diseases of the lens. So the main and the important topic in the diseases of the lens is the cataract. So the cataract, it means cataract that present as a waterfall. Literally, cataracts means a waterfall, any opacity of lens or its capsule causing a visual impairment is called a cataract. So, cataract is defined as it is the opacity of the lens. Lens is avascular, therefore, it cannot develop inflammatory diseases. Commonest disease is the degenerative process, that is the opacity of lens fiber, and it causes the cataract. So commonest diseases is the degenerative process. There is a degenerative process in the lens which causes opacity of lens fiber and it leads to a cataract. Care must be taken in using the term cataract clinically since it often excites the anxiety which may be entirely unjustified. And it is to be remembered that many congenital opacities are stationary and even in senile cataract, the opacities may remain localized for many years without causing serious visual impairment. So, it is often wise to tell such a patient that he has lentil opacity and to go suggest that the development of cataract may be long delayed and will be dealt with according to the need. So, the classification of cataract, as we see that there is a firstly congenital and developmental cataract, then blue dot cataract, coronary cataract, capsular or polar cataract, sutural cataract, corolliform cataract, floriform cataract, central cataract, lamellar cataract, and total cataract. In that there is a soft cataract and second is a membranous cataract. So there are the many types of the cataract are present. So this is the diagrammatic presentation of some classification of cataract. That's some types of the cataract. That is, this one is a posterior subcapsular cataract that you see is this. This is the posterior subcapsular cataract. Then this is a coronary peripheral cortical cataract. This is a anterior cortical cataract. This one is a subcapsular cataract. This is a pyramidal cataract as this is a pyramidal shape, so it is called as a pyramidal cataract. This center is located, it is a nuclear cataract. Around the nuclear cataract, there is a lamellar cataract. This one is a lamellar. Then, next is a posterior polar cataract. It is situated posteriorly. So, it is called as a posterior polar cataract. So, in a cataract, when we see it is acquired, then there is a senile cortical or cuneiform cataract, nuclear cataract and posterior cortical cataract. So these types are come in an acquired cataract. And when there is a trauma to the lens due to the mechanical trauma, concussion, contusion or penetrating injury, and chemicals like a systemic absorption of chemicals like naphthalene, lactose, galactose, thallium, and radiations like infrared, UV rays, X-rays, radium, and electric like passage of electric current through the body, then this causes a trauma to the lens and it causes a traumatic cataract. Third one is endocrine. That this is due to the diabetes mellitus, hypoparathyroidism, and cretinism. And in systemic diseases like Mongolian idiocy, myotonic dystrophy, dermatitis, which can these are the systemic diseases which causes cataracts. Then complicated. Last one is congenital cataract is present at the birth. and developmental cataract develop during the development of the lens. So congenital its name is suggests that it is present at the birth and developmental is suggests that it develops during the development of the lens. These cataracts are developed due to the some disturbances at a certain phase of the growth of the lens. There is a maternal malnutrition, then maternal viral infection, insufficient oxygenation due to the placental hemorrhage. So these cataracts are developed due to some disturbances like maternal malnutrition, maternal viral infection, and deficient oxygenation due to the placental hemorrhage. Then we see in the congenital and developmental cataract there is a blue dot cataract. So the blue dot cataract is a tiny bluish white opaque spot all over the lens. There is a no visual disturbance. So blue dot cataract it is also called as a punctate cataract. In the punctate cataract, perhaps this is the most common type of the congenital cataract and it appears as multiple tiny blue dots that is blue spot and scattered all over the lens especially in the cortex by oblique illumination with the slit lamp. The bluish color is due to the effect of dispersion of light in the same way that the skin appears blue. That it is a sky blue appearance of the lens, so it is called as a blue dot cataract. The visual acuity is not affected, so there is a no visual disturbance. Then coronary cataract. Coronary cataract it is a club-shaped opacities in the peripheral cortex arranged like a corona or crown and it develops at puberty. There is a no visual disturbances because axial area is clear. So, in the coronary cataract, this is the type of developmental cataract occurring at puberty. It is situated in the deep layer of the cortex and the most superficial layer of the nucleus. It appears as a corona or club-shaped opacities near the periphery of the lens, while the axial region and the extreme periphery remains clear. So there is a corona-like appearance, so it is called as a coronary cataract. As they are hidden by the iris, dilatation of the pupil is essential to recognize these opacities. Does not interfere the vision because axial area is clear. So this is a diagrammatic representation of a coronary cataract. So how it looks like? This is the diagram A and this is B and this one is a C. So coronary cataract A and B as seen by the oblique illumination in optical section with the beam of the slit lamp respectively. And in C, there is a clinical photograph of coronary cataract that how is seen in a patient. Then next is the anterior capsule. So anterior capsular cataract is also called as the anterior polar cataract. Delayed formation of anterior chamber during the development of the lens. There is a white opaque is formed in the anterior lens capsule in pupillary area. The opacity may project into the anterior chamber in the form of the pyramid, that is the anterior pyramidal cataract. It is generally acquired when it develops due to the contact of anterior lens capsule with the ulcer of a cornea and following perforation of ulcer and drainage of aqueous humor. So this is the anterior capsular cataract. In this, it is a sharply demarcated opacity at the anterior lens capsule and usually the size is of a pin head. So this is a anterior polar cataract. It is sharply demarcated opacity at the anterior lens capsule and usually the size is pinhead. It may project forward into the anterior chamber and like a pyramid, so it is called as the anterior pyramidal cataract. In this diagram, we see it is a pyramidal cataract that it is bulges as a pyramid. Then, subsequently, a subcapsular cataract may develop, and just behind it, with a clear zone in between. Reduplicated cataract. It is called as the reduplicated cataract. This is due to the delayed formation of the anterior chamber during the development of the lens, and these opacities are stationary and rarely interfere with the vision. So next is a posterior capsular cataract. It is also called as a posterior polar cataract. Due to the persistence of posterior part of a vascular sheath of a lens, and opacity is tiny. So there is a tiny opacity. And this is due to the residue of the attachment of hyaloid artery on the posterior lens capsule. This is usually dot-like as insignificant. The dot is called as mitten dot. However, in a few cases, the lens may be invaded by a fibrous tissue and a total cataract is formed. So, complication of posterior capsular cataract it lead to a total cataract. So, as we see, this is a posterior polar cataract that it is situated posteriorly and it is the residue of the attachment of hyaloid artery on the posterior lens capsule, and this is usually a dot like. So this dot is called as the mitten dot in a posterior polar cataract, that is posterior capsular cataract. Then next one is a sutural cataract. So sutural cataract is a tiny opaque dot in a Y sutures of the lens. There is a no visual disturbance. So it is a tiny opaque dot in Y suture. It arranged as a shape of the Y. So it form a as Y shape here. And it is a Y suture of the lens and there is a no visual disturbance. Then next is a coralliform cataract. In that there is a minute opacity in the central area of the lens and there is a no visual disturbance. So this there is also a minute opacity but in the central area of the lens. The central area of the lens shows the minus opacity with the no visual disturbances. It can be defined as a coralliform cataract. Then next is the central cataract. Central cataract when there is a nucleus of the lens shows opacity. So when the nucleus of the lens shows opacity, then it is called as a central cataract. And granular opacity, there is a no visual disturbances. The whole nucleus is opaque and there is a visual disturbances. In this, when there is a granular opacity in central cataract, then there is a no visual disturbances. But when the whole nucleus is opaque in a central cataract, then there is a visual disturbances. Then next is a lamellar or zonular cataract. It is also an important type of the congenital and developmental cataract. In this, there is a commonest type in children and usually bilateral. may develop in the latter part of the intrauterine life or in early infancy. It is associated with vitamin D deficiency and with evidence of rickets. There is a opacity of one zone of lens fiber and rest of the lens and the nucleus is clear. Few lamellae of the lens fiber are affected, so there is a lamellar. On dilatation of the pupil, central circular disc-shaped opacity surrounded by a clear lens. So there is a linear opacity, spokes of wheel and visual disturbances. So when we see a lamellar or zonular cataract, it is probably the most common type of developmental cataract presenting with a visual impairment. It may be congenital or occur within the first year of the birth. It is usually bilateral and often hereditary, that is autosomal dominant without any other ocular anomalies. It is associated with the hypovitaminosis D, that it may be the evidence of ricket or hypocalcemia, may be with the tetany or defective tooth enamel and maternal malnutrition, and a unilateral cataract may follow a blunt trauma of the eye. The characteristic feature of this lamellar or lunar cataract is that it consists of concentric, sharply demarcated zone lamellae of the opacity surrounding a core that is clear and enveloped by the clear cortex externally. So there may be a linear opacity like a spokes of the wheel, called as the riders, that extend to outward toward the equator, and when present it is a pathognomic. Then it is a child with the zonular cataract may present with the photophobia due to the light scattering. Surgery is considered when the visual acuity is less than 6 by 8. So there is a visual disturbances seen in this zonular and lamellar cataract. So when we see in the diagram A, B and C, that is the lamellar cataract. In that there is a diagrammatic presentation as seen by the oblique illumination and in optical section with the beam of a slit lamp respectively. In that we see the slit lamp respectively. And this is a clinical photograph how the laminal cataract or zonular cataract is seen. Next is a total cataract. It is a unilateral or bilateral. Then it is seen usually a congenital. So this is a type of total cataract. So this is a diagram of a child that we can see his lens, that there is a dense opacity of the lens. It is seen congenitally, and this is a diagram of total cataract. It is a bilateral type, usually congenital. Entire lens is opaque and lens may remain soft or liquid. The congenital complete cataract is due to the disturbances of development or some intrauterine inflammation, like maternal rubella during the first trimester. So, congenital cataract is very badly seen in a patient, that is in child, when there is a maternal rubella during the first trimester. So this is an important cause of the congenital cataract, that is a total cataract. It is unilateral, bilateral, but in this diagram we see there is a bilateral cataract in the child congenitally, and lens, entire lens is opaque and lens may remain soft or liquid. The pattern of rubella is the most common cause during the first trimester. To examine, so how to examine the cataract? So to examine the congenital and developmental cataract, pupil must be dilated with 1% atropine drop. So as we know, the pupil dilatation is necessary to examine the cataract. So we can use a 1% atropine drop for the examination of congenital and developmental cataract and for dilatation of pupil. Then in the treatment, it depends on the visual disturbances that when there is a zonular or total cataract, it requires a treatment, and other type do not cause a much visual disturbances and may be left on. So when there is a total or zonal cataract, it requires treatment. But other types do not cause much visual disturbances, so it may be left alone, or it may not require that such a treatment. Then this is a diagram of cortical cataract. In that we seen that is this is a lens. Hmm? This is a opaque cortical spoke. This is iris. This one is a lens. And in this lens, we see that how the lens is a solid. This is a nucleus. This is a cortex, and there is a capsule. So this is a cortical cataract. In next diagram, that is a posterior capsular cataract. In that we can see how there is a granular deposit in posterior subcapsular cataract. This is iris, this is lens, and this is granular deposit. And in this view, we can see how the granular deposit in posterior subcapsular cataract. This is a nucleus, cortex, and capsule. Next is a lamellar cataract. The most common type of congenital cataract occur from the opacification of specific layer of zone of the lens fiber. So this is a type of lamellar cataract. Then in this diagram, we can see in the central that is a nuclear cataract. Around that there is a lamellar cataract. Then this is a posterior cortical cataract, and this is a polar cataract. हॅलो हां लेक्चरमध्ये करते फोन तुला 11 नंतर बोल 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 हां दे त्याच्यासोबत त्या पित्ताची गोळी दे हां sorry student. So we was saying about the diagram of cataract. So in that, in the center there is a nuclear cataract. Around that there is a lamellar cataract, and this is a posterior cortical cataract, and this is a polar cataract. This one is a coronary cataract. This is a subcapsular cataract, and this is a lamellar cataract. Okay. So next is a acquired cataract. In that there is a senile cataract. So senile cataract, the aging lens tend to become opaque after the age of the 50 year, and by the age of the 70 over the 90% of the population shows the some evidence of the cataract. It occurs equally in men and women, and it is usually bilateral, but often develop earlier in one eye than the other. There is a considerable genetic influences in its occurrence, and in hereditary cases it may appear at an early age, even before the age of the 50 in a successive generation. That is a pre-senile cataract. So it is occur above the 50 year, but not uncommon in lower age. Equal in both the sexes, bilateral, that is earlier in one eye, hereditary, Earlier in subsequent generations, 55% of total blindness is due to the senile cataract. Then types of the senile cataract. So there is a cortical or cuneiform or soft cataract. The pathology we see that lens fiber of the cortex are affected. There is a hydration due to the accumulation of water droplet in between the fibers. Proteins are denaturated and the coagulated opacities with the ultimately whole lens became opaque and pearly white appearance. So firstly there is the lens fiber of the cortex is affected. When the cortex lens fiber are affected, then there is a hydration due to the accumulation of water droplet in between the fibers. And proteins denaturated and coagulated, so it becomes the opacity, and ultimately the whole lens become opaque and there is a pearly white in appearance. So senile cataract may be broadly divided into the two types, though they may occur concurrently. First is a cortical or soft cataract. It is seen in 75 to 80%. The classified feature of hydration followed by the coagulation of lens protein and appear primarily in the cortex. And second is a nuclear or hard cataract. The essential feature is shows progressive sclerosis in the lens nucleus. So, when we see the symptom of a cortical cataract, then we see that there is a granular impairment of the vision, polypia, one object appear multiple rainbow halos around the light due to the accumulation of water droplet in between the lens fiber. So there is a rainbow halo and polypia with the gradual impairment of the vision. Then signs are depend on the stage of cortical cataract. We see there is the first type, first stage is the incipient stage. In that spokes of opacity with the clear areas in between at the periphery of the lens. So spokes of the opacity with clear areas in between at the periphery of the lens. Second is a progressive stage, that is the further opacities, and third is the immature stage when there is a opacification increases further and lens appear grayish. Cortex is still clear, there is no iris shadow is still visible. Iris shadow, it is the shadow of a pupillary margin on lens when oblique light or pupillary margin. Importance, there is a still small amount of the clear lens matter present below the capsule. So this is the immature stage of this cataract. In that we see how the opacity is formed, the lens appear is a grayish color, cortex is a still clear, then so iris shadow is still visible and it is a shadow of pupillary margin on the lens when oblique light on pupillary margin. And there is a still small amount of the clear lens and matter that present below the capsule. Then fourth is the intumescent stage. In this, cataract is immature but the lens is swollen due to the fluid. The anterior chamber become shallow. Next is the immature cataract. In that, there is the entire cortex become opaque. Outline of opaque lens is visible. Iris shadow disappear. Vision reduce and cortical cataract mature in 1 year. So this is a mature cataract. In that entire cortex become opaque white, outline of opaque lens visible, iris shadow disappear and vision reduce with the cortical cataract mature in 1 year. So next is a six, that is hypermature stage. So this is a diagrammatic presentation of hypermature stage of. In that first is the Morganian type. When there is a whole cortical matter liquefies, the lens is converted into the bag of milky fluid with the nucleus settled at the bottom and iris shadow disappear, cataract appear uniformly milky white. So this is a Morganian type of the hypermature cataract. In that we see how the nucleus settle at the bottom and iris shadow disappear and cataract appear uniformly a milky white. And it is a milky white color of then B, that is sclerotic type. Due to the alteration in the permeability of the lens capsule, some cortical matter goes out and is absorbed. The lens become flatter, so capsule become thick and cataract appear brownish. Anterior chamber become deeper and there is a no iris shadow. So the way this is occur when there is a sclerotic type of the hypermature cataract. Then the diagnosis of acquired cataract is that when there is an immature cataract, then there is a grayish lens and iris shadow is present, with the finger counting at the close distance to the eye and black shadow against the red fundal glow on the light in the dark room. And a mature cataract, how we diagnose it? That there is a pearly white lens, no iris shadow, vision reduced to the perception of the hand movement, then there is a low fundal red glow